Famotidine, PF, 20 mg per 2 ml intravenous solution is used to treat ulcers in the stomach and intestines, and to prevent intestinal ulcers from recurring after they have healed. It is also used to treat certain stomach and throat problems such as erosive esophagitis, gastroesophageal reflux disease, GERD, and Zollinger-Ellison syndrome. This medication works by reducing the amount of acid produced in the stomach, which helps to relieve symptoms like persistent cough, stomach pain, heartburn, and difficulty swallowing. Famotidine belongs to a class of drugs known as H2 blockers. This specific form of famotidine is given through a vein and is used for a short period when it is not possible to take the medication by mouth. Your doctor will switch you to taking this medication by mouth when it is feasible. It is important to follow your doctor's instructions regarding the dosage and timing of this medication. When using famotidine, PF, 20 mg per 2 ml intravenous solution, it is important to follow the instructions given by your doctor. The dosage and duration of treatment will depend on your specific medical condition and how well you respond to the treatment. For children, the dosage may also be determined based on their body weight. If you are administering this medication to yourself at home, it is essential to thoroughly understand the preparation and usage instructions provided by your healthcare professional. Before each dose, make sure to clean the injection site with rubbing alcohol. Additionally, visually inspect the product for any particles or discoloration before use. If you notice either of these, do not use the liquid. It is also important to learn how to properly store and dispose of medical supplies. It's important to communicate with your doctor if your condition persists or worsens. Some common side effects of famotidine, PF, 20 mg per 2 ml intravenous solution may include headache, constipation, diarrhea, or pain/redness at the injection site. However, many people using this medication do not have serious side effects. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. If you experience any serious side effects such as easy bruising/bleeding, signs of infection, mental/mood changes, or hallucinations, it's important to tell your doctor right away. In the case of very serious side effects such as fast/slow/irregular heartbeat, severe dizziness, fainting, or seizure, it's crucial to seek medical help immediately. Although a serious allergic reaction to this drug is unlikely, it's important to get medical help right away if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects that are not listed, it's important to contact your doctor or pharmacist. Before using famotidine, it's important to let your doctor or pharmacist know if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions or other problems. It's also important to inform your doctor or pharmacist of your medical history, especially if you have immune system, kidney, liver, lung, or other stomach problems. If you experience symptoms such as heartburn with lightheadedness, sweating, dizziness, or chest/jaw/arm/shoulder pain, especially with shortness of breath or unusual sweating, it's important to seek medical help right away. Older adults may be more sensitive to the side effects of this drug, especially mental/mood changes, seizures, or unusual tiredness. If you are pregnant, famotidine should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking famotidine, PF, 20 mg per 2 ml intravenous solution. Some products, like fezolinetant, may interact with this medication, affecting how well it works. Additionally, some products need stomach acid to be properly absorbed by the body, and since famotidine decreases stomach acid, it may alter the effectiveness of these products. These include atazanavir, dasatinib, certain azole antifungals, levoketoconazole, pazopanib, sparsentan, and others. It's also important to note that you should not take this medication with other products that contain famotidine or other H2 blockers, such as cimetidine, nizatidine, or ranitidine. Always consult your doctor or pharmacist before starting, stopping, or changing the dosage of any medications. If someone has taken too much famotidine, PF, 20 mg per 2 ml intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. It's crucial to act quickly in these situations to ensure the best possible outcome. It's important not to share this medication with others. In addition to taking this medication, making lifestyle changes such as reducing stress, quitting smoking, limiting alcohol, and adjusting your diet by avoiding caffeine and certain spices may help improve the effectiveness of this medication. You should discuss with your doctor or pharmacist about lifestyle changes that could benefit you. Your doctor may also recommend lab and/or medical tests, such as endoscopy or kidney function tests, while you are using this medication. It's important to attend all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of famotidine, PF, 20 mg per 2 ml intravenous solution as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Famotidine, PF, 20 mg per 2 ml intravenous solution is used to treat conditions such as ulcers, gastroesophageal reflux disease, GERD, and excess stomach acid. It can also be used to prevent stomach ulcers and heartburn caused by certain medications. The usual dosage of famotidine, PF, 20 mg per 2 ml intravenous solution is based on your medical condition and response to treatment. This medication is usually injected into a vein by a healthcare professional. It is best to take it at the same time each day to help you remember. Be sure to follow the storage instructions provided with the product, and always keep medications out of reach of children and pets. Do not dispose of medications in the toilet or drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.